Hello, I am Melissa Zahorik, one of the benefits specialists from Ameritas. I want to welcome you to the Ameritas Life Insurance and Extend Health Retiree Health Coverage webcast. Ameritas is changing the way we are currently providing health care benefits to our retirees. We will be allowing for retirees to have a choice in the health care they choose, while Ameritas still subsidizes all or a portion of the coverage. All eligible retirees and spouses who are 65 and older will be impacted by this change. So what is going to be covered today? We are going to talk about what is changing and why, and also how this will affect you. I will introduce you to Jason Debenham from Extend Health, who will talk about the Medicare marketplace, what will happen going forward, and anticipate and answer any questions you might have. Be sure to look in your mailbox for more information coming your way from Extend Health, and remember, you need to call Extend Health as your decision needs to be made prior to September 1st. So why the new approach? The current Ameritas Post-65 health plan is a carve-out plan. It may not always pay the expenses that Medicare does not cover. Instead, the plan looks at what it would pay as if you were still employed. If Medicare pays more, then the Ameritas plan does not pay anything. In many cases, our retirees are using the plan as a substitute for a Part D plan, which is the part of Medicare that covers the prescription drug expenses. However, without getting into too many details of your current plan, let's talk about why we are making this change. Transitioning you, our retirees, to Extend Health, who we will talk about in a little bit, allows you to have more choice in your health care. It also gives you the ability to customize your coverage to fit your needs. We are confident that this change will be successful as Extend Health specializes in providing these services to retirees across the U.S. Another reason for the change is it allows Ameritas to achieve more predictability in the company costs and allows us to remain competitive and provide strong benefits. Now let's talk about how this affects you. The cost. What you pay may change. It all depends on what coverage you choose. Ameritas will be providing each eligible retiree and spouse a health reimbursement arrangement to help subsidize the cost of the coverage you choose. Jason will explain more about the health reimbursement arrangement as the presentation continues. How you enroll. You will work with Extend Health to enroll in a plan that meets your medical and prescription needs. They will also help you set up the health reimbursement arrangement. Who is your support? The Extend Health licensed benefit advisors will help you understand the costs associated with your coverage. Everything, the premiums, co-payments, deductibles, and all other costs associated with your new healthcare plan. So let me introduce you to Extend Health. Who is Extend Health? They are an independent company who partner with over 80 health plan carriers. They employ objective and trusted U.S.-based benefit advisors. Those benefit advisors are focused on helping you make an informed and confident decision. They will be with you on each decision you make and will make sure that all elements of your coverage are accounted for. They are going to make sure you get the coverage you want at the most affordable price. So why Extend Health? They're experienced in helping people just like you. Their passion is helping you choose the coverage that is best for your needs. And one of the best things, their services are at no cost to you. So let's take a look at the companies that have transitioned their retirees to Extend Health as I turn the webcast over to Jason.
Well, thank you very much, Melissa. Well, hello everyone. My name is Jason Debenham, and I'm glad to be on the line with you today. I'm very excited to be able to talk about the wonderful benefits that we're going to be able to offer to you through Extend Health. Now, as Melissa was mentioning, there's a lot of excellent plans out there, and I'm sure you're wondering, is the coverage I'm going to have through Extend Health going to be similar to what I've experienced through Ameritas? And I can tell you right now that yes, there's a lot of excellent plans going forward through Extend Health that you'll be able to choose from that will have excellent levels of coverage. And so I just want to kind of give you some background on Extend Health and help you understand some of the many companies who we've already assisted in getting them into their own Medicare plans. And so to date, we've already assisted over 250 employers from 45 different Fortune 500 companies. Some of these companies you may be familiar with, and I'll just throw out some names. Companies such as Ford, GM, Chrysler, large companies that are here based in the U.S. that we've had the excellent opportunity to be able to assist their retirees to look at new Medicare health coverage options. We've also had some experience working in the private sector as well, such as Round Rock, Texas, City of Waco, Texas. We've had the privilege of working with Nevada public employees and their benefits group. We've also worked with Lawrence Livermore. And so at this time, I just kind of want to make sure I'm answering those big questions for you. First of all, what kinds of plans, what kind of options will I have going forward through Extend Health? Second, what's it going to cost me and what can I expect with the benefits with these plans? And third, how does this coverage compare to what I have or have had right now through Ameritas? How are these plans going to compare to what I have through Ameritas? So going forward through Extend Health, you're going to have three main types of Medicare plans you can choose from. The first one is the Medicare Advantage plans. Those plans, if you've heard of the term HMO, PPO, that would fall under the Medicare Advantage bracket. The second type of plan would be a Medigap or a Medicare Supplement plan. These types of plans are an excellent option if you don't want to have to work within a type of network, and with those you're allowed to see any doctor who does accept Medicare. The third type of plan will be a Medicare prescription drug plan, also known as the Part D coverage. And so we do have over 80 different insurance carriers that these plans are offered through. Let me just give you an example of some of the companies that you may be familiar with. AARP, Coventry, SilverScript, Express Scripts, Aetna, Humana, WellCare, Cigna, Sterling, Regence Blue Cross and Blue Shield, Delta Dental, and VSP Vision Service Plan. And once again, that's a small sampling of over 80 different companies that we currently do work with right now. So let me talk with you now about the process and how we help you at Extend Health. First of all, we want to make sure that the proper education is in place. We want to make sure that as you're looking to make a change now into a new plan, that you can feel comfortable with your new plans and with your new options. And so we want to make sure you can understand as much as possible. Now, to help with this, we do send out some information in the mail. But with this information, it's going to be going over those three main types of plans I just mentioned. And so at Extend Health, not only do we hope to help you understand these plans a little bit better and how they work, but likewise, we also need to be educated by you. We need to be able to understand your needs and what you're looking to get out of your plan. And so your benefit advisor, who you will work with on a one-on-one basis at Extend Health over the phone, they will be the ones to make sure that they can understand what you're looking to get out of these plans. Now, husbands and wives, you're certainly going to probably have different doctors you may be seeing. You probably have different needs, different prescriptions you're taking. And so your benefit advisor will ask you and make sure that they do find out what those needs are so that they can give you a better recommendation and help you understand the plans that may be of more interest to you at Extend Health. And so once we've got that basic education in place and we feel like you understand a little bit about the plans through Extend Health and that we feel like we understand the needs and what you're wanting out of a plan, we then want to go over those different plans with you and those different options and make sure that we can get you into something where the plan and all the information and all of its benefits make sense to you and you feel like that's a good match. And so your benefit advisor will be able to use their professional opinion to tell you which of the many different plans we're going to have available through those over 80 different insurance companies can meet the needs of what you're looking for. Now, we do get people asking us different questions that meeting special needs, such as maybe living in two different states during different times of the year. Your benefit advisor can certainly give you excellent recommendation as to what plan could fill that need for you. But basically, once your benefit advisor has gone through these different plans with you and they've found one that you feel like you are comfortable with, at that point they can help you enroll into that plan all over the phone. It's a very simple, easy process. As a third part of this process, we help you manage that coverage with that plan that you enroll into. That means should you have any questions such as about your benefits or your coverage on this plan, or maybe you're interested in changing to a completely different plan, Extend Health will be the ones to assist you should you need to manage anything regarding that. And so you can always call back in to Extend Health and we'll have the benefit advisors there on staff to assist you. But let me talk a little bit more in detail about that education process. Now, first of all, there's going to be a few key things we want to do. We're going to be sending you in the mail an enrollment guide. And in this enrollment guide, it's going to go over some of these basics of these different plans and go over some of the basic information. Also in this enrollment guide, it's going to ask you to do a few things. It's first of all going to ask you to gather some basic information, such as some prescriptions that you're taking right now. It's going to ask you to gather any doctors that you're seeing right now that you would like to continue to see. Now, with that information, your benefit advisor will be able to narrow down and really look at what plans that will be available to you that should be of more interest to you. Now, it's important to note at this time that any pre-existing conditions are not going to limit your plan selection. And so because you're coming off of your group plan at this time, you're going to have what's called guaranteed issue to pick the plan that you want. There's only one thing that can limit you to certain special plans, and that's if you're pre-65 with end-stage renal disease. Now in that situation, there are special plans through Medicare that are designed to cover you in that situation. Now once you've gathered this basic information and you're ready to call in and speak with your benefit advisor and start going over these different plans and the information, we'd ask that you give us a call. And this is the toll-free number for the Ameritas retirees. The number is 855-651-5056. Now, for your convenience, we also have an excellent website that you can go to see a lot of this information, and you can even look at plan information on there as well. This is at www.extendhealth.com/Ameritas. Now this will be coming in the information you receive in the mail and is printed on the back of your enrollment guide that you do get. Now your benefit advisor, once they got this information, they're going to use this to help prepare you for that enrollment discussion. Once again on this call, they will review with you those different Medicare basics and the information and go over the kind of general information of those three types of plans. You'll also at this time be able to set an actual appointment, a date and time in which you can speak with your very own benefit advisor when it's convenient for you. Once you've set that official appointment, we do send you a confirmation letter in the mail, just letting you know when it gets closer to that date and time where you can speak with your advisor. On this website, there's a lot of excellent tools that you can work with. First of all, on the Extend Health website, you can look at the full plan information. Basically what it does is it takes some of your basic information, such as your zip code, your county, and based upon that, it can look at all the different Medicare plans available to you in your local area. With this, it'll give you full plan information, and so it'll tell you the name of the plan, it'll tell you what type of plan it is, such as a Medicare Advantage or maybe a Medigap plan. It'll tell you the full plan details, it'll tell you your monthly premium, any deductibles that may be on the plan, as well as any copays that can apply on that plan. It'll tell you basically everything you need to know about this plan and understand how the coverage works. And so I'd highly recommend, if you like to do a little research on your own, maybe dig into the different plans and information, that you do go to this Extend Health website, and there you can look at the different plans that will be available to you. Let me give you some background information on these benefit advisors and how they can help you. First of all, these benefit advisors, we have a 100% domestic workforce. They're actually based here in the U.S. and Utah and Texas. And so that means when you're speaking to your very own benefit advisor, they will be very fluent in English. Due to the fact that we work with so many different insurance carriers, they do have to be objective in advocating for you. And so they're not going to recommend any one company over another, but what they will do is they'll find out the specific needs that you're wanting and what you're looking to get out of a plan. And based upon that, it doesn't matter which company, they'll give you their expert recommendation. They're going to be neutrally compensated and they're paid hourly, so it won't matter to them what company, but they want to make you as happy as possible. And so they're going to make sure that the plan they recommend will be a great fit for you. Now, our benefit advisors, in order to be able to be prepared to assist you and go over all these different plans and information with you, they go through a process called Extend University. What this is a yearly education process where they learn about any changes to Medicare or to the different plans throughout these many different insurance carriers. And so they do have to make sure that they are licensed in your state, they have to be certified, and appointed with each one of those insurance companies. And so if we offer over 80 different companies, it's quite a bit of information. I can tell you from personal experience, having done this in the past, that yes, it's quite a bit of work. Now, just in case you're curious, the average age of one of the benefit advisors is actually 43. And so it's very possible that the benefit advisor that you work with could be on Medicare themselves already. For your convenience, you can reach one of our benefit advisors from Monday to Friday from 8 a.m. to 9 p.m. Eastern Time Zone. And so let me go into a little bit more detail on the enrollment process and how that phone call with your benefit advisor will work. Basically, if you choose to set up an appointment or not, you can call in with yourself or with friends or family members. You can have them all on the line on your discussion with these different plans and benefits with your own benefit advisor. And so they can speak with anyone. But your benefit advisor will need to speak to you as the actual participant who is enrolling to complete the enrollment. Now, once you've made your plan selection, that enrollment is done all over the phone. Your benefit advisor is actually filling out on the computer an electronic application that they will send directly into the insurance carrier that you then choose. Now, it's important to note that for your protection and to make sure that we're doing an excellent job of assisting you and giving you a professional recommendation, we do record 100% of our phone calls. Now, your benefit advisor, as they're filling out that application for you, they are going to need some key pieces of information. It goes directly on your application. And so the first thing you're going to want to make sure you have with you on your phone call to your benefit advisor is your red, white, and blue Medicare card. From this card, they're going to need your full name, your Medicare claim number. That could look like your Social Security number with a letter before or after it. And they'll also need on that card your Medicare Part A and your Part B effective dates that it shows. Once again, this information is required and it's part of your application and enrollment process. And so let's talk about your future coverage and go over what you can expect. First of all, you're going to continue to have your primary coverage through your Medicare Part A and Part B. You'll then have additional coverage with either a Medicare Advantage with prescription drug plan, an MAPD, or you'll have that additional coverage through a Medigap with a standalone prescription drug plan. There'll still be optional coverage such as dental and vision available to you through Extend Health. But let me go over those two main plan types. First of all, option 1, a Medigap with a Part D drug plan. Now, the purpose in a Medigap plan is to fill in the gaps in original Medicare's coverage. If you're familiar with original Medicare, you know that typically it'll pay about 80%, leaving you to pay 20% out of pocket after your Part A and Part B deductibles. The great thing about these plans is that if you get one of the more comprehensive Medigap plans, it can cover that 20% and it can cover the Part A and Part B deductibles for you. These plans do provide additional coverage for doctor visits and hospital stays, as well as other expenses that are partially covered by original Medicare. Now, the one drawback about these plans is that they do not provide prescription drug coverage. That's where you choose a standalone Part D drug plan that works side by side with it. And so your Part D drug plan can be a completely different company if you want. You don't have to choose both plans through the same insurance carrier. Let's talk about option 2, a Medicare Advantage plan. A Medicare Advantage plan provides an all-in-one plan benefit that'll bundle your Part A, your Part B, and your prescription drug coverage together with additional benefits, sometimes such as vision, dental, even hearing. These plans will provide coverage for your doctor visits, your hospital stays, and your prescription drug expenses. One of the drawbacks with these plans, and you want to make sure this is going to work with you, is that you have to work within a network. And so you want to make sure your doctors, if you want to continue to see them, that yes, they'll accept this coverage. And so if you're interested in one of these types of plans, your benefit advisor can look into that for you and see if your doctors will work with one of these plans. Let me cover the Medicare prescription drug coverage now. This may be a little bit different than what you've experienced through your group plan through Ameritas. Under Medicare drug coverage, there's 3 different levels. The first level is called the initial coverage level. Under this, you'll pay any deductible if the plan has one, and copays under your plan. And you'll do this for the first $2,970 in actual cost of medications on the plan that you've chosen. Now that number is referring to the retail cost of the prescriptions you're taking. And so let's say when you go to pick up your drug at your pharmacy, let's say you pay a $5 copay. Now the actual retail cost of that prescription could actually be much higher. What they do is they tally up that retail cost, and so when it reaches the $2,970, that's when you hit the second level of coverage, which is called the coverage gap or donut hole. You've probably heard about this before, but let me explain to you what this really means. Under this second level of coverage, you then pay a percentage. You'll pay 47.5% of the cost of your brand name drugs and 79% of the cost of your generics. And you'll do this until your out-of-pocket costs reach $4,750. Now that cost is split between you and your pharmaceutical company. And so once you reach that $4,750, you hit the third level of coverage. This is called the catastrophic coverage level. At this point, you'll then pay $2.65 for your generics and $6.60 for your brand name drugs, or 5%, whichever is greater. Let me go ahead and give you some plan examples and what you could expect to see on a plan. This plan, of course, may not be available in your area, but it does kind of give you an overview of what you could expect on a plan. This is a Medicare Advantage plan. It's a PPO. The monthly premium would be $36. It has no in-network deductible. Your primary care physician would be a $20 copay. A specialist visit would be a $35 copay. For your hospital care, days 1 through 5 would be a $270 copay per day. If you go to the emergency room, that'd be a $65 copay. Under this plan, it does include drug coverage. For your prescriptions, there's a $95 deductible on all drugs except for your Tier 1 generics. For your prescriptions, your Tier 1 generic will be a $4 copay. Your Tier 2 non-preferred generic will be a $12 copay. Your Tier 3 preferred brand name will be a $45 copay. And your Tier 4 non-preferred brand name will be a $95 copay. Any specialty drugs you pay 33%. With mail order on this plan, it usually saves you a little bit of money, and this is for a 3-month amount. And this is for a 3-month supply. Your Tier 1 preferred generics will be a $6 copay. Your Tier 2 non-preferred generic is an $18 copay. Your Tier 3 preferred brand name drugs is a $112 copay. And your Tier 4 non-preferred brand names is a $237 copay. Any specialty drugs you still pay 33%. Now let's give you an example of a Medigap plan. In this example, I'm going to use a Medigap Plan F. It's one of the more comprehensive Medigap plans with a standalone prescription drug plan. We're also using the example of a 75-year-old male. And so on this plan, your monthly premium would be $238.50 a month for the Plan F, and then an additional $33 a month for the prescription drug plan. Your total would then be $271.50 a month. Under this plan, you can visit any Medicare eligible doctor. This plan is great because it's so comprehensive you have little to no out-of-pocket cost for your medical or hospital care. And so on this plan, you have no deductible, no doctor and no specialist copay, no hospital care copay, no emergency room copay. For this drug plan that was chosen to go alongside of it, it has no deductible. And on this plan, for your Tier 1 preferred generic drugs, that's a $6 copay. For your Tier 2 preferred brand names, it's a $45 copay. And for your Tier 3 non-preferred brand names, it's a $95 copay. Any specialty drugs, you pay 33%. If you do mail order, once again, you do save money. Your generic drugs are then a $0 copay for a 90-day supply. Your Tier 2 brand names are a $90 copay. And your Tier 3 non-preferred brand names are a $190 copay for a 90-day supply. Let's go ahead and cover now your health reimbursement arrangement. This is the money coming from Ameritas to help assist you with any expenses you may have on your plan. And so first of all, what's an HRA, a health reimbursement arrangement? It is a tax-advantaged account that's used to reimburse you for any eligible health care expenses. Now, in order to qualify for this account, you do have to meet Ameritas eligibility requirements. Your HRA funds will become available to you starting September 1st of 2013. And so let's go over that process of how this account works. First of all, Ameritas will allocate the benefit dollars to a HRA account of every eligible participant. Once the participant enrolls through Extend Health in their individual coverage, they then qualify for that plan, and then that HRA account will be administered by Extend Health. Then the participant will be reimbursed for any healthcare expenses using those HRA benefit dollars. So there's going to be two ways that you can get reimbursed for your expenses. The first one is through filing a paper claim form. And so let me kind of give you an example of how this would work. In this example, once a participant pays their plan premium or their co-pays on their plan, you'll then fill out this claim form, and you'll get some of these in the mail later on in the year. And you'll attach any required information, such as some kind of receipt showing the expense that you had. You'll then send that in to Extend Health, and once we receive it, we'll verify the receipt of your payment and that yes, you're eligible for the reimbursement. And we'll then send that reimbursement payment back to you by one of two ways. Either by default, a paper check in the mail, or if you've set it up with us, we can have the money direct deposited back into a bank account of your choosing. Let's talk about the other method of how you can get your money back. This is called automatic reimbursement. In this situation, when you pay your plan premium to your insurance company, that insurance company will then forward a receipt of your payment directly onto Extend Health. As normal, once we receive this proof of your payment, we will then send you that reimbursement once again by either a paper check in the mail, or we can direct deposit it into a bank account of your choosing. So what is automatic reimbursement? Automatic reimbursement is a service that's only offered by Extend Health. Your automatic reimbursement can only apply towards your premiums you've paid and not towards out-of-pocket expenses such as a copay. Automatic reimbursement is not available in all plans. And due to the timing of automatic reimbursement, it is usually not the fastest way to get reimbursed. You'll be receiving forms and instructions provided in the HRA welcome kit that'll be coming to you later on in the year. There's a few key things you want to note about the automatic reimbursement process. First of all, your initial automatic reimbursement may take up to a few months. The reason for this is once you've set up your new HRA account, we have to actually wait for your insurance carrier to send proof of any expenses that you paid directly onto us before we can send you a reimbursement. And so for the first few months that this is happening for automatic reimbursement, there is a little bit of a delay. And so that first payment can take up to 3 months. But any premiums paid prior to the activation of the automatic reimbursement will be reimbursed all at once. And so if you need your reimbursement sooner, simply file a paper claim form. Once your automatic reimbursement is activated, you can expect to receive your reimbursement around the same time each month, just like clockwork. So let me go over some next steps with you. First of all, please review your enrollment guide when you receive it in the mail. Make sure you gather that basic information, the prescriptions you're taking, and any doctors you want to continue to see. Then we'd ask that you give Extend Health a call at 855-651-5056. And so one of the great things about Extend Health is even once you're enrolled, you're still going to have continued support and advocacy from us. And so should you need any assistance, we'd recommend that you contact Extend Health at 855-651-5056. You will have direct support for claims issues, appeals, and network questions. You're also going to have assistance through the renewal process, which is the ability to pick new coverage for future years. So that means you're not going to be locked into this year's choice. You're going to have ongoing enrollment services, and we can certainly help assist you and have you speak with a benefit advisor and go over any plans and options. And so at this time, let me cover some of the most frequently asked questions. First of all, do you offer plans that cover me in multiple states? I am a snowbird. Medigap plans are accepted by every Medicare participating provider in the U.S., with some emergency benefits worldwide. If you travel frequently or live part of the year out of state, these plans may be right for you. Part D plans provide nationwide coverage from participating pharmacies. Medicare Advantage plans cover urgent and emergency services nationwide, but some may not provide nationwide coverage for non-emergency services. If you live part of the year out of state, these plans may not be right for you. Question: I remarried after I retired. Is my spouse eligible for Extend Health services? The answer is no. You will not be able to qualify for the program subsidy. However, Extend Health can assist you with individual plan coverage. Question: how often will I be billed, by whom, and can I pay by check? When you enroll in a new plan, you'll need to begin making premium payments to the insurance company in order to maintain your coverage. Some insurance companies may require the first month's premium payment during the application process. In this case, you should expect to make a payment within a few days of your enrollment. Please have your billing information ready when you make your enrollment call to Extend Health. Most insurance companies give you several billing options for ongoing payments, such as direct billing, paid by check each month, electronic funds transfer from your checking account, or automatic deduction from your Social Security check. You can choose to pay monthly, quarterly, or yearly. Question: if I don't like the plan that I enrolled in, when can I change? Every year, you will have an annual Medicare enrollment period during which you can investigate other medical and drug plans and potentially enroll in a different plan. However, during future Medicare annual enrollment periods, your current medical conditions may limit the plans available to you. You will receive notification from Extend Health of the annual Medicare enrollment period, which is October 15th to December 7th. We encourage you to contact us should you have any questions. Question: will I be refused coverage due to a pre-existing condition? Will I pay more? Can my policy be canceled once I'm enrolled because of my condition? And can my rate be raised for that reason? If you enroll in a Medigap plan when you first transition from group coverage and you wish to change to another Medigap in the future, you will go through medical underwriting. You will not necessarily be denied, but your monthly premiums could be higher. Your policy cannot be canceled once you are enrolled unless you do not pay your premiums, and your rate will not be raised for medical reasons. Question: what if I have the option for other coverage, such as a spouse or through the military? If I don't enroll with Extend Health, can I enroll later? Yes. During open enrollment each fall, you will have the opportunity to reevaluate your medical plans. If you wait to enroll through Extend Health, you will lose your HRA funding. If you wait to enroll, you may also be subject to pre-existing conditions. Call Extend Health to find out the details. Question: will my premium rates increase every year? If so, by how much? In general, insurance premiums do increase every year. The increase in plan cost year to year can vary widely. We advise our enrollees to contact us and compare other plans if you experience a rate increase in the 10 to 15% range. The national average is 3 to 4%. Question: are there plans that will cover me when I travel domestically or internationally? Medigap plans are accepted by every Medicare participating provider in the United States, with some emergency benefits worldwide. If you travel frequently or live part of the year out of state, these plans may be right for you. A few Medicare Advantage plans also have worldwide emergency coverage. Question: how does Extend Health make its money? Will our services be free next year? Now, on a high level, Extend Health is paid just as any agent would be, by the carrier and not by your company. Our services are always free to you. Question: can I obtain medical and prescription drug coverage from one carrier, or will I need separate plans for each? Some Medicare Advantage plans have limited provisions for all of these needs. If you enroll in a Medigap plan, you will need to enroll in each option separately. Your benefit advisor can help you find the best combination for you. Well, that covers all the frequently asked questions. At this time, I just want to thank everyone for listening in, and I'd truly recommend that should you have any further questions, please do reach out to your very own benefit advisor at Extend Health. Once again, give us a call at 855-651-5056. Thank you and have a great day.